Good morning, this is Heather Longoria. I'm a therapist here at the St. John Clark Pain Treatment Center, and today I'm going to share with you a self-massage sequence for your quadriceps. So the quadriceps are the muscles that sit on the top of the femur here, and there's 4 of them, which is why they're called quadriceps, and all 4 of them merge together into the patellar tendon, which goes over the patella or your kneecap, and then it attaches down here on the tibia. So the quadriceps are made up of the vastus medialis, which is on the inner part of your thigh, right around here, and then it comes up and attaches on the upper part of your femur. And then we have the vastus intermedius, which again form a part of that patellar tendon and then attaches up here. And then vastus lateralis, which is on the side of your femur, and this can kind of get tacked down with the IT band or the iliotibial band on the side of your thigh here, and again that attaches right about here on the femur. And then on top of that vastus intermedius, we have the rectus femoris, and that crosses 2 joints. It crosses the knee joint because it attaches down here on the tibia as well, and then it comes all the way up the top part of the thigh and attaches, if you feel your hip bone right there, that thing that sticks out, like the thing that gets hit on like countertops and tables and hurts like the dickens. If you go just south of that a little bit and then towards the middle of your body or the medial side, there's a little attachment point there called the AIIS, and that is where your rectus femoris attaches. So when we roll out the quadriceps, we're going to be treating all of those muscles. And this is a really important, a really effective rollout for people who bicycle a lot, which is a very quad intensive activity. And it's also really beneficial for people who have high pelvic flexion and low back pain as a result of that. So your quadriceps, especially your rectus femoris, since it attaches here on the hips, can pull the hips into an anterior pelvic tilt. And then when you have more of that anterior pelvic tilt, that causes a lot of compression in the low back. So let's get started. We're going to take a yoga tune-up Coregeous ball. This is air-filled grippy ball. And we're going to place it on our belly. So just be careful of your xiphoid process, which is a little bone that protrudes down from your sternum, and it's right between where your ribs meet right here. So you just want to go south of that, right around the belly button area. All right. And then you're going to take some yoga tune-up balls in their tote and cinch it so they stay nice and tight. And then place the balls right above the kneecap. And then you can use your toes to push yourself back and forth across the ball. And then you can play with internally rotating your femur a little bit so you get more into that vastus lateralis down there. And then externally rotating so you get more into the medial side of the knee. And you can bend and straighten your leg. And that's kind of doing a pin and stretch of all of those quadriceps. And then you can move the balls up into the center of the thigh. So we're moving more into the muscle belly here. And if you've never rolled your quadriceps before, this can be very intense. So your first step is always just to do compression, and then let your body sink down into the balls on that exhalation. If at any point you're rolling and you feel like you can't breathe because the pain is so intense, then you need to back off, and instead of maybe laying on top of the balls, just use the balls with your hands to roll out your quadriceps. So once you get them situated in the middle, then again you can use your toes to roll out the whole length of the muscle there. And if you find some spots that are extra tender, just hang out there for a couple breaths, focusing on really lengthening out the exhalation and seeing if you can encourage your body through awareness to just like soften and let go of tension. And then once that spot comes down a little bit, then you can keep going and find the next juicy spot. So I encourage you to explore the whole length of the femur there, and just notice after you roll, like this quadricep is so much hotter. So I'm already bringing a lot more blood and awareness into this leg. And for cyclists, I really encourage you to play around with rolling out your quads before you cycle. I've noticed that I can handle hills much better if I roll out my quadriceps before I bike, because my quads are already so tight that they don't really have much more force production left in them. So if I roll them out and loosen them up, then I have more power when I ride. And then it's also really important to roll out your tissues after you ride as well. And your legs may be sore depending on the length of your ride, so you can also use the Quadricep ball to roll out your quadriceps too. Again, that would just look something like this. And especially if you can do that on bare skin, you're going to get some really nice fascial work done there. So it's going to help separate those tissues and get your tissues to slide and glide the way they should, and kind of help move some fluid through your legs as well. So hopefully you found that helpful. If you try this out before or after you ride, let me know how it works, and I hope you have a great day. Thank you. Bye.